Ghana's healthcare system began with a tax funding system that provided free public health care. The system became unstable with economic stagnation in the 70s. In the 80s, there was medical shortages such as medications and medical supplies. In the 1983, the administration decided to expand healthcare services. This later became known as the cash and carry system. This meant that someone had to pay before receiving treatment, that they were hoping that these fees would help improve facilities, but unfortunately it didn't because most of Ghana's population being poor, the cash and carry system wasn't something that they could afford. In the 90s, the government began to create other ways to finance their healthcare systems. They began offering non-government organization health insurance that was intended to be community-based. This was a popular option for members and international donors. This organization was only targeted to certain areas which weren't convenient for the poor. After years of trying to come up with a solution and failing, the National Health Insurance Scheme was established under Act 650 in 2003. This indicated that the government had to provide public and private health care. Ghana's healthcare system is completely controlled by the government, and the system completely revolves around the Ministry of Health. Hospital governance includes the responsibility and accountability for an operation. Services are sent through multiple facilities. District hospitals provide primary care, regional hospitals provide secondary care, and learning hospitals provide teaching and research care. The main functions of the ministry include policy formation, coordination, and regulating the stakeholders in the health sector. Policy implementations are carried through the public and traditional sectors. The agencies of the ministry are the public sector, the Ghana Health Service, teaching hospital boards, and the government institution hospital. At each level, there is a team of management that administers the affairs of services. Districts report to regions, and regions report to national levels. The private sector is responsible for 40% of healthcare delivery, and the main providers in the private sector are the mission-based providers, Christian and Muslim hospitals, and medical and dental practitioners. The ministry promised to provide everyone with health care by 2000. The government has since then established polyclinics in 9 major regions. They expected that when people became ill that they would visit a polyclinic and only be transferred to a hospital in emergencies. When people began visiting the clinics, they became aware of how poorly funded and supplied they were. Ghana has cedi currency, which has severely devalued. 100 equals $22.50 in American dollars. It is richer in timber, gold, and diamonds. Even though there isn't a way of manufacturing or exporting these products. The ministry is financed by the government. They are responsible for funding the health system that includes the hospitals and salaries of the health professionals, including physicians. Physicians receive housing and transportation as part of their salary. Majority of the healthcare funding is put towards health promotion and disease preventions. Their priorities are more toward maternal and child health, meaning that there aren't enough funds for older adults and long-term care. Family members are responsible for caring for older adults until their death. Ghana has a cash and carry system that requires an individual to pay certain expenses up front before receiving care. This means that those who don't have the money to cover medications have to go without. Ghana is one of the few countries in Africa to begin publicly financing care to the public and other vulnerable groups. They have done so by adding payroll taxes on public and private formal sector employees, subsidizing premiums from informal sectors, and embarking 2.5% of points of the country's added value. Single legislation authority, National Health Financing Reform, was passed. They have been evolving from a community-based health insurance plan to a mutual health insurance plan. The system has increased coverage, standardized administration, and beginning implementation on the modern health management information system. Ghana has made many challenges financing their healthcare system. Hopefully they are on their way to better their healthcare system. There are very few medical transportation vehicles. Usually when an individual has an accident, a bypasser rushes them to the hospital. Sadly, there isn't usually any emergency or trauma care available, so the individual usually dies anyways. There's only one major hospital in Ghana, Korle Bu Hospital. Even this hospital is limited to certain things. Many places in Ghana don't offer any kind of technology such as radiology. This means that certain scans and pictures can't be taken of an individual. With these resources, they could save many lives. Hospitals only provide one meal a day, and the patient's family is responsible for providing the other one. Ghana has made many efforts improving guidelines, policies, and in-service training. Supervision, monitoring, and evaluations have also been improved. Previously, fewer efforts have been made, resulting in the health system not providing as much care that was needed. Because of Ghana's major concern for women and children, they are taking more care of than men and older adults. Majority of Ghana's interventions all focus on the children. They recommend and focus on health, childbearing services, and child health and developments. Most children don't make it to their first birthday due to poor living conditions. Most of Ghana's diet include yams, stews, soups, rice, and other vegetables. And majority of the population can't afford transportation, so they walk everywhere and for long distances. Because of walking everywhere and a healthy diet, obesity is very uncommon. There are many environmental challenges in Ghana due to the tropical climate, rainy season, dry season, malaria, breeding mosquitoes, unclean drinking water, piped-in water, poor sewage, pit lanterns, cross-contamination of crops, burning of rubbish, unstable electricity in urban areas, no electricity in rural areas, and no refrigeration. A huge problem making prevention difficult is that Ghanaians don't go to the doctor when needed. They usually wait too long and their condition is out of the doctor's hands. Another problem is that most meals are prepared with palm oil. This is resulting in more people having high blood pressure and diabetes. Ghana is trying to prevent people from having to spend as much money on medications, and pharmaceutical companies are trying to produce as many medications locally as possible to save the community money. The president of Ghana announced that they were going to invest heavily in education and preventative health care. In the coming years, they want nurses and doctors to know the treatment of the diseases such as hypertension, diabetes, high blood pressure, and high cholesterol. Overall, they are hoping to educate people about a nutritional diet that prevents some of the diseases. The president also wants to discuss the importance of exercise, physical education, and bring sports back into the school system. Children are very loved in Ghana. Ghana is a society that values women and the number of children they have. Women have zero social status until they have children. The more children she has, the more she is praised. African reproduction is considered a way of creating the family lineage and helping build the community. They strive to have large families to build up the strength of groups. Many children die before their first birthday, and they usually die from diarrheal diseases. These diseases are caused by poor sanitation, poor drinking water, poor feeding practices, and living under poor conditions in general. Due to the infant mortality rate, women purposely have many children hoping a few will survive. Boys are preferred and girls are not. Girls are later appreciated for the love and assistance that they provide for their family and the home in which they live in. A family is everything in Ghana. In a household, there will be nieces, nephews, and cousins. The family in which they are living with are responsible for school and all living expenses. When a family member is hospitalized, the family must purchase and deliver the prescribed medications to be used while in the hospital's care. They also must provide one meal a day. The family gets to choose which meal they will serve, breakfast, lunch, or dinner. Ghanaians live in very poor conditions. Their pipe water and electricity are very unstable in certain areas. The most common diseases are cholera, typhoid, tuberculosis, anthrax, tinnitus, chickenpox, yellow fever, measles, infectious hepatitis, malaria, HIV. These are certain illnesses, and specific hospitals will not consult because certain conditions are considered to defy specific understanding. These conditions are boils, rashes, and headaches. They are required to see an apostolic doctor for respiratory, heart problems, and malaria. Ghana's poorest residents are women and children. The majority of women and children live in rural areas where there are not many physicians. Most specific and apostolic physicians live in urban areas. Care in rural areas is provided by community health nurses, traditional birth attendants, and traditional healers. The ministry had started polyclinic on rural areas in hopes that they could provide care for those in need. Instead, when the people of Ghana started visiting polyclinics, they realized how poorly they were funded. Therefore, the people stopped going to the polyclinics. This caused people to go without care or to see traditional healers. It has been suggested that better health care may be implemented by an individual religious orientation, traditional beliefs, and practices.